Today I'm presenting a study we have done from Fundación Huésped, that is an organization based in Argentina, and in partnership with an organization of transgender people from Argentina that is called ATA, and with the support of Open Society Foundation. 3 years ago, we actually conducted a qualitative study on perceptions of stigma and discrimination, trying to understand how much was the burden of living with HIV on actually being a transgender person. Well, what we have found is many things we heard before, that stigma and discrimination actually it has a negative impact in transgender people access to health, education, work, problems with housing, and family and social networks. Basically, with this internalized stigma also leads to self-exclusion behavior, lower levels of self-esteem. And we also asked them which resources they consider will be useful to face this situation of stigma. And among other things, like social acceptance from those who actually care, and having social networks, the main thing that they mentioned was to have a legal framework that recognized their identity. They understood that as a way to, as a route to improve their living conditions, to being considered as a citizen or with human rights and all citizen rights. Well, actually, our government, a year after that study, enacted the gender identity law. That is a very particular law compared with other countries, as it not only recognizes the right to live according to our gender identity, whether this matches or not our sex assigned at birth, but also allow us to change our identity in all our ID cards and passports and all our documents without having any requirements or any medical or administrative approval, which we understand that is a very important step forward. And that law also guarantees comprehensive healthcare access, such as hormone treatment and surgeries. So, considering that study we have conducted before, we just designed a research project that had two components. One was a quantitative study, and we actually did it, and we reached 500 transgender people. What we tried to do was to have a baseline of their living conditions and situations of stigma and discriminations in different areas, and a lot of information of healthcare access, HIV, and other STIs infections. The idea of having this baseline was to have the opportunity in the future to understand how many benefits or not has having this law, to measure the impact of the law. And the other component was to do a qualitative study, that is the study I'm just presenting today, that was to ask representatives of the transgender community from different regions of the country to express which were their perceptions of how the law has been impacting in their life, in their living conditions, and which were the improvements they have noticed, and which were the barriers or they have encountered so far. This study was conducted a year after the law was implemented, and we decided to call it, or just to say that there is a follow-up study, because we actually recruited the same participants from the study 3 years ago. And we divided them according to the HIV status, just to control if this variable may have an effect on their perceptions. And the result, which was analyzed with a thematic analysis. We had 21 representatives from ATA organization, this is a transgender community. Most were women and one transgender man. Well, first thing we did just to check that we have the same we were in the same ground. It was that we were talking about the same situations of stigma and discrimination and in the same areas, so to see how the law has impact on them. I think that just my colleagues have explained a lot of this, so I will move forward and just go to the next one. Well, when we ask how they perceive the impact of the law, the first thing that they just mentioned was that the law has empowered the community. It is interesting that they say, well, it's not that the law has changed the society perceptions of ourselves, but the law has allowed us to perceive ourselves in a different way. It just gives us the opportunity to stand for our rights. It just has given us the opportunity to open more doors and more opportunities. They consider that law as a recognition of their existence and their citizenship. The law was also a resource to face stigma discrimination, and based on this empowerment, it also increases visibility, and of course, hopefully, it will also help to change social acceptance. Well, when we ask in which areas they perceive more changes, one of them was education, not only because transgender people was coming back to school, they were resuming education, and also because some schools and principals have changed their attitude. There were some stories where they told us how the principals of the same school they were rejected a couple of years ago. They call and say, well, would you like to resume your education? We will open the doors for you this time, because there is a law that agrees with that. And also, there are some schools particularly that are dedicated or more like trans-friendly, so it's the first places where they try to go and gather because it's easier. And they are not afraid. It is just like a safe environment for them. They also explain that, for example, there are more activists going to schools, training students and training educators, just to being able to understand how to work, how to treat them in a sensible way, use the proper vocabulary. And also there are some training courses at educational level at this time, hoping to help the population to insert in the labor market. At this time, when we ask them about how is the employment situation, not many changes have been observed for the whole population. It was just only 1 year of the law. But what they mentioned was how they, as an activist, have changed their status. Many of them used to work voluntarily. At this time, most of them were involved in different, for example, regional or national politics, like being candidates or working as an advisor on diversity issues, or working in departments on human rights and diversity. And it was interesting how many of them say, well, we now have a tax number. Now we have a bank account. That was just a way to say, well, we are getting into the labor market. And another aspect that it was mentioned several times was everything related with social and civil rights, political and civil rights. Something that probably is very common for us. It's just like to walk around easily during the city, just take a tram, a bus. Well, for them, that was a big change, being able to just move around the city during the day and not being scared of being detained. Actually, police violence has also reduced a lot, because they just not that say, well, your ID doesn't match with your appearance. And that has been a tremendous impact, positive impact. And the other thing that they mention is, like, in our country it's compulsory to vote, and many of them usually tend to reject going to vote because they have to present an ID that doesn't match their appearance. But now with a new ID, with their chosen name, they all just has returned to vote in an exercise that civil rights. In terms of health in particular, the perception was that the law has really facilitated and is promoting a better and earlier access to health care, not only in terms of HIV specialists, but just health care in general. There has been an increase, a big increase in the number of consultations, for example, for hormone treatments and surgeries, and this change in the attitude also, like increasing HIV testing, or better, and also a better engagement with the HIV cascade. It is explained because they can change their names in their medical records. They can be called by their own names, and that's like a positive situation and very encouraging. But, well, it's not everything positive. There are some barriers, of course, and one of them is in all areas, but particularly in terms of the healthcare area, is the lack of professional training on transgender issues. So sometimes, and there are also some differences between the metropolitan area of Buenos Aires and the interior of the country. The interior of the country is much more conservative. Sometimes it's very challenging to find professionals willing to work on these issues, or if the professionals are willing to work on these issues, it's difficult to find institutions that are open to do it. So finally, our conclusion so far is that the gender identity law has had a very positive impact because it empowers a transgender population to cope with an internalized stigma, to just stand in a different position in terms of exercising their rights. And this it can be seen as a structural intervention in terms of reducing their vulnerability in terms of HIV. Of course, we also just suggest that or recommend that it would be good to have clinics by regions, just to sort that difficulty of having all professionals knowing how to treat or which are the diversity issues. Well, that's all for tonight. Thank you.